I'm Sue Kinn, and I'm the team leader and a research manager for the Health and Education Research team in Research and Evidence Division. Well, we invest in research because we need evidence to base our decisions upon, and without good quality evidence we might actually do things which aren't working, or worse, are doing harm. What we know from our experience over the last 10 to 15 years is that where there's a good, strong evidence base, we make the biggest changes to our practice and we can make the biggest impact on the lives of poor people. We fund research in three main areas. We fund research on the development of new technologies. We also look at research which is about how do we deliver most effectively what we know works already, or looking at how we can improve systems. And we also fund research which looks at understanding the context in which we're working, so that we can look at barriers and facilitators to improve service delivery. We use a number of different funding modalities, and so our research in health really covers four main areas. We look at communicable diseases, so TB, malaria, HIV and other neglected tropical diseases. We also look at reproductive health, maternal health and child health. We have a stream which looks at health systems research, and DFID really has a niche and is recognised internationally as being quite a leader in terms of supporting research which looks at systems and how to strengthen them. And we also have a small portfolio on non-communicable diseases. And right across those four different areas of research that we fund, we use different funding modalities. One of the things that we do is support research on the development of new products for mostly infectious diseases, so our communicable disease area there. And we do that through the support for product development partnerships who are developing new vaccines, diagnostics, microbicides, drugs, or insecticides for particular diseases. That takes up a fair amount of our budget, about 30 to 40% of the total budget. We also fund research programme consortia. These are consortia of partners, a number of different institutions with one lead institution, and partners in 3 or 4 developing countries. They have a central theme and then a whole programme of work around that theme. So we might get the same work being done in a number of different countries, which allows us to make comparisons, or we might be able to learn lessons between countries where we're not doing exactly the same work, but things which are more specific to individual contexts. The RPCs also have capacity building built into their structure, so that we hope that when the research finishes, there's a legacy and the partners are able to continue to do research. RPCs also have an element about research uptake. So they're looking at mechanisms to improve the way that the research once done is taken up by the relevant policymakers to shorten the pathway to impact for the research. We have a number of programs that we also fund that are based at the World Health Organization. So there are special research programs on tropical disease research and human reproduction, and there's also the Alliance for Health Policy and Health Systems Research. So these areas are very much in line with the three of the four key areas that we are funding research in, and we provide core funding to those institutions who are then working with partners across the world to make sure that they're asking really important and relevant questions for research, with a focus on implementation research and making sure that what we know works gets into practice. We have a number of other mechanisms as well. We have really excellent partnerships with the UK Medical Research Council and the Wellcome Trust, and we're building relationships with other research councils. And we also fund jointly a number of programs, for instance, the Saving Lives at Birth, which is looking for technological innovations around newborn, which is also funded by the US, Grand Challenges Canada, Norway and the World Bank. So a number of different partnerships as well. What we try to do is make sure that we have a clear idea of what our aims and objectives are and research questions that we want to ask, and then we make sure that we make the funding modality match with the most sensible way of answering those questions.